Bismillah ar-Rahman ar-Rahim, Shabab. Still in the nursing process steps. I'm going to step 3 is the planning. Step 3 is planning. This step 3, it is the planning, and the planning how manage the problem. The nursing how manage the problem. Planning is the third step, nursing process. Provide direction for nursing intervention. Direction to the nursing action or nursing activities. The planning phase, it is where goals and outcomes are formulated, the direct impact patient care beside evidence, beside practice, and nursing care plan are essential in this phase of goal setting. It is very important. Planning starts with first client contact with nurse or with relationship, ends properly when the client is discharged from the healthcare facility. The planning starts from patient enters the facility until discharge, and also in discharge you put discharge planning to the patient. For this reason, they have type of nursing planning: diagnosis, nursing planning, initial planning, ongoing planning, and discharge planning. Initial planning, this is done by the nurse who contact the patient, assist usually, and some nurses would be want to create initial comprehensive part of care. Ongoing planning, and this is done by all the nurses who work with the client. All nurses work with the client. You put the ongoing planning. Nursing obtain new information, evaluation, client response to care, individual essentially, to care individual essentially, and also care plan also occur at the beginning of the shift, from beginning of the shift. Ongoing planning follow the nurse, determine if client health status has changed, set patient client during shift, dictate problem to focus during the shift, coordinate with nurse to ensure that more than one problem can be addressed to each client contact. This is the ongoing planning. Go to the third one, discharge planning, and this process planning for need after discharge. After discharge, to provide continuously of care nurse need accomplished with the following: how to put the discharge planning, how put the discharge planning. So the discharge planning start with all client, admitted to any healthcare setting. Also involve client and client family support process in planning process. Collaborate with other health. This point to be collaborated with other health professional need and physiologist, cultural and spiritual need. Ensure that. Okay. Also developing nursing care plan. This is developing nursing care plan we call NCP, and this formal process that it actually identified existing need, recognize potential need or risk. Care plan provide communication among the nurse. Their patient and other health provider to give health care outcome. Also, without the nursing care planning process, the quality and consequently of the patient care would be lost. يعني nursing care planning, if not put it good, the nursing care is not quality and not effective, should be lucid. Planning step discuss in detail in nursing care plan, element guide and database. Okay, go to steps 4 of nursing process. It is implementation, all nursing action. Put the plan into action. The planning, nursing care planning, put in action. The implementation phase of the nursing process, it is when the nurse put the treatment plan into effect. You put into effect. Give medication, take vital sign, okay? All this, the implementation of the nursing care. It is involve action or doing and the actual carrying out of nursing intervention outlined in the plan of care. This typically beginning with the medical staff contact any need medical intervention. Action associated with the nursing care plan include monitoring the patient for sign of change or improvement, directly caring for the patient or conducting important medical tasks such as medication admission. Education planning, education awareness, okay? Follow up, okay? Nursing intervention classification system, okay? And this is have more than 550 nursing intervention label. It's a very more classification system, this according to the nursing intervention, okay? Behavioral nursing intervention, and this is designed to help patient change in the behavior, to help patient change in the behavior. And patient behavior is the key, and the goal, it is modify. It is follow measuring, encourage steps, providing support to quiet smoking, engaging the patient in some form of physical activity like walking to reduce the patient anxiety, angry, and honestly. All this, the behavior planning. Okay. Community nursing intervention, this also in the intervention, community health nursing intervention, and this refer to the community-wide approach, health behavior change, wide approach health behavior change, and community intervention recognize host of other factors that is contributed to individual capacity to achieve optimal health, optimal health, and this is community nursing intervention, الأكشن حقت النيرس في المجتمع. Example, education program for first time, mother promoting diet and physical activities. Also, initiating HIV awareness and violence preventing program. This is the steps, the planning, the implementing, and this implementing, it is the 4 steps of nursing care, and